So hello, everybody. Welcome to today's session. If you have a blanket handy or a towel or a block or a pillow or a bolster, go ahead and make it handy for yourself if you like. Just to give the body some support for some of the things that we may be doing. You may not need the support, but it's always great to have. So taking a couple deep, easy breaths, settling into body. Settling into the moment right here. Allowing breath to deepen into the lower ribs. You may find you can either hold yourself up really upright, or you can allow the ribs to expand in the lower rib cage. Go for the ribs. Allow for some slack in the body. As long as you aren't too far forward, compressing the lungs. I love it. So I can talk structures with you all, and you'll understand exactly what I'm saying. Bringing some awareness to the face, allowing face to find some ease, because again, facial nerves are right next to cranial nerves. They communicate. Vigilant face equals vigilant nervous system, and vice versa. Then feeling into an intention for your practice today. Feeling your way there, not thinking your way there. Body knows what it needs. Prefrontal cortex gets involved and things get wonky. So maybe it's as simple as I feel at ease in my body. I have one student who has allowed me to share and sometimes says it's okay for me to feel safe in my body. That is their intention. All right, we're going to do a release class. We're going to be focusing on shoulders, which means we are going to be getting into belly, and we are going to be getting hands-on on our tissues, the issues in our tissues. So let's just see what things feel like. You can go ahead and roll the shoulders. Just seeing what the sensation feels like. Maybe it's smooth and easy, which I'm happy for you. Maybe it's crunchy and sticky. Hopefully we'll make them either less crunchy or sticky, or crunchy and sticky in a different way. It doesn't just go right into ease sometimes. Sometimes it's a peeling back of the layers. Come to center, take a breath. Easy face. Go ahead and roll the head out a little bit. Go to your 60, so don't go to your 100%. Just feeling the sensation, not going for stretch. Being in communication with what's there. Sometimes stuff gets loud in the body because we don't listen to it. It's like a child. They just get progressively louder till you finally listen. Come to center, take a couple deep, easy breaths at center. We're going to give some love to the collarbones first. Again, the platysma, which starts at the jaw and ends below collarbones, has a big, huge say in what is going on in neck, head, shoulders, upper back. So we're going to give love to that first. Hands or fingers are going to be above and below the collarbone. So you can do live long and prosper. You can do peace. You can use both hands, just as long as you're doing kind of a scissoring motion and getting some relief in those tissues. They hold up the head, and especially if the head is in a somewhat forward position, whether you work on a computer or a handheld device, And head can go in the opposite direction of the way that you're pulling. All that pressure, it's even heavier for the body to hold it up. So it has to build up that tissue, lock it down a little harder. So we're going to release this. Also, this is where lymphatic system drains, kind of like the heart of the lymph system in the collarbone. So releasing collarbones means body can get trash and inflammation out easier too. Go ahead, take a breath at center. Notice if that shoulder has dropped or shifted. This can be a daily practice. I often do it before I brush my teeth so my lymph is draining properly. And let's do the opposite side. Seeing how this side may feel differently. Usually dominant side is going to be a bit more locked down, a little denser. And if you're pumping lymph, you'll go gentler, but here we're trying to release the tissues, the issues in our tissues. So body will go into a protection response, whether it's from stress or an injury or whatever it may be. And it kind of stays there until we tell it it's okay to let go, whether it's through breath work, meditation, mindfulness, massage, hands-on release like we're doing now, where we're doing it mindfully. All right, hopefully both shoulders feel like they're somewhat the same height again. Taking a couple deep, easy breaths, always coming to center, allowing body and nervous system to get used to it. Letting it know that it's okay to be in this range, a looser range of being. Because we're going to be giving love to all those tissues that hold up our heads, we're going to start this whole ridge. We're going to massage it out and loosen up the tissues. So starting behind the ear, back behind the jaw, right underneath the ear, all the way down to the collarbone, massaging that in whatever way feels good for you. So you can push back towards the back of your head. You can pull that tissue forward if you like, and also down. So making sure you're getting at least those three directions. And yes, I would definitely consider going opposite hand. That way you aren't using the muscles that you're releasing. And we're also crossing the midline of the body, which means we are integrating both hemispheres of the brain. And again, structurally, through the fascia, through that network, that web that encases everything in the body, we are getting multiple lines. We're getting the spiral line that starts in the feet and spirals up the body through both sides, up and then down. We're getting the arm lines of the body, front and back, which connect here. And we're getting both the superficial and deep front and back lines of the body. So everything kind of runs through here. And again, this is kind of like giving your own adjustment. Being aware if these muscles come online when you're doing other things that it may not need to come online for, but body loves to make sure we're secure and protected and supported. All right, go ahead and release. Notice if that shoulder shifted just a little bit. I always feel like Quasimodo when I do these things. I do one side and I'm like, I feel like I'm like this. And then I do the other side. I'm like, oh, okay. Maybe. Take a couple breaths. Again, notice if the breath in that side of the body feels a bit more spacious, because we are loosening things that pull on the upper rib cage as well. All right, let's go ahead and get the other side again. We're starting in the area just below the ear, back behind the jaw, that whole strip down to the collarbone. So pushing towards the back, pulling towards the front and down. You want to get at least those 3 directions. And loosening tissue here can loosen tissue in a lot of areas and also loosen stress on the nervous system. You have 3 cranial nerves back here. You have lymph that drains back here. You have major blood flow that comes through here. Veins and arteries. So it's kind of a big deal. And it holds the head up. Also kind of a big deal. So again, we're incorporating Ayurveda, the sister science to yoga, into our practice. On release, notice if things feel a bit more even, hopefully. Take a couple deep, easy breaths. Noticing if there's a bit more ease in the face. Noticing how the breath feels. Maybe it feels a bit more spacious because we are loosening the upper rib cage. Breath expands that rib cage 360. Out all sides, spherically 360. Three-dimensional. All right, so we're going to get into a bit more of a functional movement release. Arm comes out to the side, palm is going to face back behind you. Arm comes back behind you in a way that's comfortable so that there is no sensation in the shoulder joint. So my hand is really low. It isn't up at my waist. It isn't up higher. It's pretty low in my case. Go ahead and pin that tissue inside the collarbone. And then go ahead, turn head away. You can put different ranges of motion because you're going to engage different tissue. So however it feels good, maybe it's your fingers that feel good pinning that tissue. Maybe you're in there with your palm, the heel of your palm, whatever feels good for you. And you can readjust multiple times. Again, we're getting multiple fascial structures and lines in the body that help support everything. And release, come out. Take a couple breaths. Especially when we're releasing tissue in the neck. We want to give the nervous system and the body time to get used to it. It's been supporting and gripping and holding and protecting for a long time. Restructuring fascia can take some time. right, let's do the opposite side. Arm comes out to the side, palm back. Arm comes behind the back, just slightly. Go ahead, pin that tissue in the collarbone and turn the head. So there is a physical therapist and massage therapist that I learned from. And they did this for a patient that had a thyroid scarring, getting into the platysma, getting into the front of the neck. And they had huge range of motion afterwards, after the session. And they did it for themselves because they had a whiplash. So now they do it for all their clients. They see a major difference in sensation and mobility anytime somebody has neck and shoulder issues. It's all connected, y'all. If this is tight and protecting, then everything in the back of the body is going to be pulled a bit more. All right. Come back to center. Take a few deep, easy breaths. Again, easy. You can go ahead and tap on the sternum a little bit if you like. Calming nervous system. Even rubbing down will help. That actually helps with digestion too. If you have acid reflux, getting into the sternum will help. My uncle used to say, I have the acid reflux. Acid reflux, Theo. Yeah, the acid reflux. So go ahead and roll the shoulders, see if they feel differently. Maybe they're grinding a different way. Take a breath. Gently roll the head out. Slow and easy. I know the temptation is to play with the range. Try and refrain. Go to your 50% just to feel the sensation, because I've done that. Release the neck, played with my range, and then I can't turn my head for 2 weeks. We get so excited, yay, range of motion, and then we push it. Coming back to center, easy in the breath, easy in the face, intention supported. So last week we did the pressure points underneath the collarbones and in the armpit. So we're going to get into the armpit in a different way. Again, this is going to get scapula, and it's also, if you have frozen shoulder, you need to get into this area. So we're going to get into the back of the armpit. Last week we got into the front of the armpit. This time we're going to get into the back of the armpit. So where shoulder comes down, you can feel the kind of the tip of the shoulder blade. Once you get there, you can bring the arm down, but getting into that tissue, I just needed to show you where you are. So you're in here, arm can come down. You can actually kind of hug yourself and get into that tissue. And you can get that whole ridge. You can move a little bit, twist in the spine a little bit, because yes, it will affect your twist. So you're getting into serratus, subserratus. Oh. You'll feel it. You'll explore those tissues, feel and play with those tissues a little bit, and you'll feel where you need it. Maybe not explore, just feel it out. So yeah, I'll move a little bit and see what's going on in there. And release. Again, notice what that shoulder feels like. And notice what the breath feels like, because we are getting into rib area as well. Notice if the breath can expand further, if it feels a bit more spacious. Which also means we're releasing stress and tension in the body and giving ourselves more space to breathe. It's ours anyway. We're just taking it back. All right, get into the other side, get into that bottom of the shoulder. Once you get your spot, you can, allow the arm to rest so it isn't working. Oof. So deep, easy breaths. If you find a spot and you kind of stop breathing, your breathing freezes a little bit and your face goes all scrunchy like a Shar-Pei. Make sure you are taking a beat and allowing things to be easy. Because if nervous system is in an alert, it's going to lock down and protect first. So we aren't going to get the release that we want. And yes, these are tissues that are also attached to the trapezius muscle, which starts at the base of the skull, goes out to the shoulders and ends midway down the back, maybe a little bit lower. Oof. Feeling out for those bony prominent areas. Oh my goodness. Yeah, I need to get in there more. Go ahead, release, roll the wrists out. Let's test what our twist might feel like. So feet are going to come in front of you. We're going to twist on the exhale. So turning to one side, rest back behind you, inhale, exhale, twist. Oh. Coming back to center. Take a breath. Anybody get any snap, crackle, pop? And doing the opposite side. Lean back, support yourself, exhale on the twist, or twist on the exhale. Come back to center, take a couple deep, easy breaths. How y'all feeling? Y'all okay? Feeling a little bit easier, a bit more spacious? So we are going to play with twist. We're going to get into belly and hips. So this whole trunk of the body, we're going to be releasing tension here so we can release tension everywhere. We are going to play with twist. So come on down, side first. A couple of these techniques are actually physical therapy techniques, but they are based in yoga and traditional Chinese medicine. So for your twist, if your twist is sticky and there's a lot of holding, make sure you have a pillow or blanket so that you can help yourself be supported. Go ahead and windshield wiper the knees a little bit, seeing what things feel like in the spine, what they feel like in the hip joints. In my case, I like to try and release my spine here. Notice if it needs it. And of course, hips and pelvis will get released too. Roll wrists and ankles out. And then taking a few deep, easy breaths at your center once you're all situated. Knees are bent, feet are on the ground. Knees can rest on one another. Noticing how the breath shifts when your body realizes it's fully supported and doesn't have to hold itself up. So hopefully the breath feels more expansive. The internal and external on the outside of the bones. That supportive structure can find some ease. So there's more space. You can spread more. Allowing face to have some ease. Hi, face. All right, hands come to belly, taking a couple deep, easy breaths. If you go to an Ayurvedic spa, they will do this for you. So yes, it's lovely when somebody does it for you, but doing it for yourself is good too. Gently rubbing belly clockwise. So we want to gently introduce pressure into the belly. You don't want to just go digging into the soft tissue of your body, especially around the organs. And rest at center. So just to introduce some of that release, fingers are going to come to the midline of the body, the middle. They can stop above belly button. They can start underneath the sternum, so where the ribs meet. So anywhere in that area where it feels good for you. On the inhales, we're going to allow full expansion in the belly and rib cage. And on the exhales, we're gently going to massage side to side in a wavy motion. Taking 3 to 5 breaths at your own pace. Long, deep, easy breaths. So there's a lot back here. There's diaphragm. There is the aorta that splits so the blood can feed both legs. You have the largest lymph node in the body here. Again, diaphragm because it's connected to so much, even the tissue around the heart. The vagus nerves branch off towards the left here, or just above here. So giving the nervous system some relief in multiple ways. And yes, if you have tightness in belly, you will have tightness in shoulders, hips, knees. Again, all the lines of the body are connected to here. This is also where we originate from. It's not a coincidence that we're right above belly button. And rest. Noticing what your contact points feel like, where body connects with the surface that is supporting you. Go ahead and adjust if you need to. If you have a blanket, you can put it to one side. Whatever side the blanket is on, we are going to do the opposite side. We're going to be twisting towards the blanket. So hooking fingers into the ridge of the rib cage. Hips are going to shift towards the rib cage that we're holding, just a touch. Taking that tissue, pulling it in and down towards the belly button. Legs come in, they're going to fall towards your blanket. Deep, easy breaths. So this is like giving yourself your own adjustment in a twist. And if you feel good here, you can allow the arm that we are twisting away from to come out to the side. So still holding the belly with the hand that is on the side of the bent knees, but bringing yourself into a supported twist. Gently rock head side to side, because this will release shoulders and neck as well. Rolling the free hand, that wrist out, you roll the ankles out too, you will find release in areas that you did not expect here. You can move a little bit, allowing for some release, allowing breath to be really deep. If arm doesn't feel good, if shoulder isn't all the way on the ground, you're hanging out in the air, bring hand towards you so that it can rest on the body. We don't want limbs hanging out in the air. We want everything fully supported, because that's when release happens. On the next exhale, bringing legs back to center, go ahead and recenter yourself, shifting pelvis and everything. Windshield wiper the knees out a little bit. And breathe at your center for a few breaths, noticing if the breath feels more spacious, and if you elongate the limbs, you may even feel longer in one side. I love that. Tell the people in my family all the time, getting older does not necessarily mean shrinking. We can maintain our length. We can maintain our spaciousness. All right, so blanket is going to go onto the opposite side if you have it. If you have it for support, hooking into the rib cage that is opposite the blanket. Hips shift towards that side of the rib cage. Pulling in and down towards the belly button, knees come in towards you and fall over to the opposite side. Taking deep, easy breaths. And once you feel good here, you can go ahead and allow that arm to release out, palm up. Gently rocking head side to side. Again, if that shoulder isn't down, if that arm is hanging out in the air, please bring that arm towards you, towards the body. Let it rest on the body. And yes, the rocking side to side of the head does affect those fascial lines. So you can see if you need release, if you need to rock a little bit, do whatever you need to do. And again, pulling on that tissue, giving ourselves our own adjustment for the twist. On the next exhale, bringing legs back to your center. Legs come down, windshield wiper the knees out. Noticing how body feels. Hopefully breath feels equally spacious in both sides of the body. And if you elongate the limbs, hopefully both sides feel like they're the same length again. Simple but powerful. Take a few deep, easy breaths at your center. Notice if back of the body feels differently, where your connecting points are. Breath and face easy. All right, so we're going to get the bottom of the pelvis, or the bottom, that bowl of the pelvis now, so that lower belly. If you have a blanket or a towel handy, great. If not, this will work without it. If you want to use a block, you can use that. But go ahead and bring some support, if you have it, underneath the back of the pelvis, so that when you bring your knees in towards you, you're balanced on it. Again, if you don't have anything to prop yourself up with, you can even use a book if you need to. Roll out the ankles. It's okay. This is going to work either way. So hug the knees in towards you, gently rock. Giving that low back a little bit of a massage. Take a couple breaths at center. So this is going to be for the front of the hip, for the hip flexors, but also those hip flexors that people don't really recognize as hip flexors, the psoas, and the one that wraps around from the back, wraps around the front of the hip. So we're going to get all of that. This is great for your standing poses, your lunges, all of that. Feet come back down to the floor. You're going to get into that bowl of the pelvis. So you're going to follow your waist down and get to that bony prominent part in the front of the body. Just inside that, you're going to take that tissue and pull it up and in towards the belly button. I like getting on the skin, but whatever feels comfortable for you. Deep, easy breaths, just allowing body to get used to it. Go ahead and rock that leg in and out, and you'll see how it affects all that tissue. I even feel it down into my knee and my shin. I feel it from down that side of the IT band too. It's all connected. When you're ready, you can start elongating that leg out and bring it in, doing different angles. Play with leg placement, where it's going out. It can go out to the side. You can do a little bit of internal rotation. The knee falls in a little bit. You can do external rotation where knee falls out. But allowing it to elongate out and come back in. So we're getting functional movement here, right? Because we don't just move in one plane of motion. We move in lots of ranges of motion. Breath and face easy. You can rock that knee in and out. Last couple breaths. Come back to center. Rest at center. You can windshield wiper the knees out a little bit. You can also tuck those knees in and gently rock side to side again, massaging back of the pelvis a little bit. Roll the ankles out. Feet come back down to the ground, noticing what the breath feels like in that side. Shoulders may want to readjust as well. Deep, easy breaths, easy in the face. Intention fully supported. All right, let's get the opposite side. So getting into the bowl of the pelvis. So what people call hip bones, but they're not. They're the iliac crest. It's actually pelvis. These are hip bones. Actually, they're a joint. There are two bones in the hip. Pulling that tissue up and in towards the belly button. Again, we're getting a lot of connective tissues here. Thank you, belly. Taking a few deep, easy breaths, noticing how sensation changes throughout the cycle of the breath. You can start moving that knee in and out on the side that we're holding. Noticing where else you feel it. Where down the chain you may be feeling it. Sometimes you can even feel it down into your ankle or toes. And when you're ready, go ahead, elongate that leg out and bring it back. Different angles, different directions, maybe out to the side, maybe knee rolls in a little bit, getting that internal rotation. Maybe knee rolls out, getting that external rotation. Go ahead and play with the variety here. Rolling that ankle out whenever you need to, or whenever you like, because you will feel release down that chain. Thank you, body, for literally holding me together. Again, giving ourselves our own adjustment. Last couple ones, last couple breaths. Bring legs back in. Windshield wiper them out. Go ahead and give yourself a hug. Hugging the knees in, gently rock side to side. Staying there with knees hugged in. I like hugging back behind the knee. Taking a couple deep, easy breaths, allowing belly to press into the legs. And allowing that pelvic floor to release. So noticing what it feels like throughout the cycle in the breath at the bottom underneath your pelvis, that pelvic floor. So yes, it's important to have a strong pelvic floor, but again, it's also important not to have a frozen pelvic floor that is just, locked down. So having that ability to release is important. All right, keeping one knee hugged in, opposite foot comes down, elongate out, getting some space through the front of the hip. If you aren't feeling a lot of space, if you aren't feeling a slight pull, if you will, go ahead and push through the heel, and you'll get more space through the front of that leg. Deep, easy breaths, spacious, relaxed in breath and face. Noticing what sensation feels like through the front of that leg, or maybe even the side. You may feel it in different areas too. But that whole side in the belly too, what that sensation feels like throughout the cycle of the breath and how it changes. Again, neurologically, the more attention we bring here, the more release we're going to have. While the breath and face are easy. So letting nervous system know it's okay to have space here. Especially if you're sitting at a desk all day, this is going to help with that whole, well, all the lines, spiral lines, front lines, back lines. On your next exhale, bringing leg back in towards you, rock it out a little bit. Take a breath or two at center. So what face would feel like if you were in your happy place? My happy places often involve delicious food. All right, go ahead and hug back behind the leg that you didn't do before. Opposite foot comes down. Elongate the foot out. So long leg comes long. If you aren't feeling anything through the front of the body, go ahead and push through the heel. But again, you don't want to play tug of war with yourself. If you're feeling sensation through the front of the leg, leave it at that. Deep, easy breaths here. Awareness in that cycle of the breath, having it be easy, face easy. And in belly, front of the leg, maybe side of the leg, all the way down. Focus and intention there too, noticing what things feel like throughout the cycle of the breath and how they shift. This is also great for digestion because belly is pushing up against the leg a little bit. Even if you have your leg out to the side, if it feels better for you, you're still getting some of that massage action along the belly. In yoga, they call this wind relieving pose. Allowing for more and more setting down of tension with each breath. It's yours. You can do what you want with it. Let Elsa sing Let It Go. You can just set it down for a moment. You can pick it back up if you want. Last breath. On the next exhale, bringing leg back towards you. Rock it out. All the ankles out. Feet come down. If you had something underneath your pelvis, go ahead and take it out from under you now. Windshield wiper the knees out. Notice how hip joints feel. Check out your hip rotation. What do things feel like? Settle at your center. Notice what your contact points feel like, where body connects with the surface that is supporting you. Take a moment just to enjoy it. Then go ahead and set yourself up for Shavasana and whatever Shavasana feels best for you. I do invite you to put something underneath your knees if you have access. It will help take pressure off the lumbar spine. Allowing yourself to feel supported here. What does support feel like? How do body and breath and face and intention respond to feeling supported? That felt sensation of support for the nervous system is huge. Finding that inner ground, that inner okayness, that inner resource where you are always whole and unharmed. Where you feel most secure, most protected, most supported, and most at ease. Allowing yourself to rest here, to be nourished and recharged. Gently coming back. Feeling how you're supported here. How breath naturally happens by itself. Gently rolling out wrists and ankles. Rocking head side to side a little bit. If you like staying right where you are, but finding whatever position feels most comfortable for you right now. Moving slowly if you choose to move. And if it feels good for you right now, bringing palms together at heart center, allowing sides of the thumbs to rest on the sternum. Thanking our bodies for all that they do for us. Thanking ourselves for taking time to give love and care to our bodies and beings. And I thank you for choosing to share your practice with me and allowing me to be here with you today. Thank you. Om Shanti.